This is going to be just a short video tutorial on charting in Axiom. As you can see up here, I've logged into my practice patient. One of the easiest and simplest things to do in our charting, a lot of times you will see your patient has missing teeth. So I like to put my missing teeth in initially because this will help when I'm doing my periodontal charting as well, and I won't have to worry about jumping over those teeth. But I will highlight my teeth. This patient, we're going to say Practice Miles, has all of their third molars missing. So I will highlight the tooth numbers. I will right click, and here I can put missing. And you can see in this right click on your keyboard, we can actually change primary, mixed dentition. We can put a tooth note in there about different conditions as well, or you can actually look at the individual tooth. But at this point, I'm going to put in missing teeth. And you can see in my chart, it shows all of the missing teeth. So I'm going to go back to this and just show you how it will change that dentition. You can just click to a mixed dentition, and then you will notice, see, it puts all up. There's our permanent first molars. We have our anterior, so we'll chart that mixed dentition, but we're going to go back to all permanent dentition. So the next item will be if we're adding some of our standardized charting symbols. So what we'll see, we right click on that plus button. Where we'll go is always under procedures. You will see here there's several different items listed. We will have findings, dental treatments, medical treatments. We're doing charting. It's always going to go under findings and full list. That is the most often one that we will use. You can see here's all of our materials when you are seeing patients. If you're not sure what some of the colorations are on their teeth, if you go to this and you can see there's sealants, gold, amalgam, we'll show all of our dental materials. We also will go into conditions. It will show our positional conditions, our orientation conditions, caries, or other. I'll open up each of these menus. It will show what is rotated, some of our positions. We'll show orientations. If we have impacted, interrupted, we'll show caries and decay. And then down here, other. We have supernumerary tooth, fractured tooth, where we have open contacts. Some of these it will put signage in coloration on the chart. Some of them will just note it in the EPR so that it's recorded and documented. So first of all, what we're going to do is I'm going to go in, let's go back here, and we're going to add all of our missing teeth one more time. I'm going to right click, and I'll put my missing teeth in. So right now, I do know that according to my radiographs, I have a supernumerary tooth. So I will click on tooth number 7. That's where my supernumerary tooth is going to be. I will always add that finding. And in our charting, we can see where number 7, which is common supernumerary tooth, is listed. So now we're going to go in and put our materials. So at this point, we have missing teeth indicated. We have seen on our radiograph that number 7 is missing. And so we're looking at our exam and our clinical assignment. So we notice this patient has a composite. Use our composite material. There's composite. And it's going to also be, we'll look at tooth number 10. So we're always going to highlight our 10. So the composite is going to be a facial, a mesial, lingual, Class 3 composite. I will touch that and add that in. And you can see down here where I have my composite on the mesial, lingual, facial for number 10. So the next tooth we're going to see and we're going to have is, let's look at gold. So we're going to say number 18 has a gold crown. Click on that and let's highlight all of those areas. The crown covers the entire tooth. I'm going to add my finding, and you can see right here it shows our gold crown. So the next item that I'm going to do, say for instance, I know I have a porcelain type of crown on, let's say, number 21. So I'll highlight that tooth. All of my surfaces for the crown, and then I will add that finding in there. You can see right here, it shows us we have a tooth color crown. So all of this is going to show all of our different materials that we have. Sometimes you may see in charting there may be other metals, or we might have an implant on a tooth. Say for instance, let's say 30. We're going to make that tooth is missing. And we're going to place an implant. So it's got an implant in place where 30 is missing, and we're going to add that finding. And you can see right there, it has the implant. And say, for instance, we have already got a crayon, and we're going to do a zirconia. It is a tooth color crayon. We'll place that on number 30. And we'll add that finding in there. We'll say yes. So we have an implant and a crown on that tooth. And again, it's going to show us all our treatment here that we've indicated in our charting to the right. Let's go back to the main page of our treatment history. And it also lists all of that charting in the EPR. When we're doing our practice charting, if you do have an error, I do believe your practice patient, you can go in and just touch Control or highlight it, and you can delete that entry for your practice charting. And that should be all that you need to help guide you through your charting.